Bill Marra is the president and CEO of Hotel Dieu Grace Healthcare. Bill joined Hotel Dieu in 2011 and took on his current role in 2022. Bill has developed an intimate understanding of the diverse needs of the Windsor-Essex community through his previous experience with the criminal justice and social services sector, the Ministry of Correctional Services, as Executive Director of New Beginnings, and his time on Windsor City Council. Bill's achievements and contributions to the community have been recognized through several accolades, including Talent Person of the Year, Municipal, I can't read my handwriting, apologies, award in 2022, and the Queen's Jubilee Award in 2012. Please help me welcome Bill to our meeting. Thank you.
Good morning, everybody.
Morning.
Your greenhouse is thriving.
Okay.
And for those of you who haven't had a chance to come by the campus, I encourage you to do that. It was we stumbled out of the starting gate, but I can tell you it's been a tremendous addition to the work that we do with young children at that organization. And it's a point of pride, and our staff love it. And it's just when you walk by it and it's thriving with plants, you can barely see anything other than the green happening in there. So thank you. We're very proud to have your Rotary sign there, and very proud, and I boast about it often. I promise you that I do. I'm very happy to be here, genuinely happy, and thank you for saying those kind of things. I feel very privileged. I'm a first-generation Italian who immigrated with my parents many years ago. I grew up off Erie Street. I went to this all-white, nearly all Italian and Lebanese grade school, Catholic grade school, and then I went to this wonderful public high school, W.D. Lowe on Giles Boulevard, where life's lessons were learned, not just in education, but life's lessons. Where at that time, in the late 70s and early 80s, one of the most diverse high schools in southwestern Ontario, and it was a good experience. And I feel very privileged to do what I do. This is my last stop in my career. I'm going to retire from Hotel Dieu Grace. I have absolutely zero intentions to pursue politics or anything else. But the work that we do at Hotel Dieu Grace on Prince Road is relevant each and every day. It makes a difference each and every day. Bob, it was great seeing you at the new Plasma Center. If you haven't donated yet and you're so inclined to do so, it's a wonderful experience, and that's where we reconnected. And Carlo, I got your text message. Thank you. I inadvertently ran into him in Orlando, Florida about a year and a half ago. I'm looking up my balcony. I'm going, is that Carlo down there? Only Windsor Essex folks, right? So I'm going to speak briefly about the cyber attack. And I want to pre-qualify what I say by sharing this. It's from my experience, my perspective as the CEO of one hospital. And as you can see, I don't have notes. I don't like being scripted when I present, unless it's a press conference where legal counsel said, this is what you have to say. I want to share with you my perspective, and the perspective of 13 or so hundred employees and many thousands of patients that are impacted by what happened. But it was in the middle of the night on October 22nd, which was a Sunday, into the morning hours of October 23rd, of course, a Monday. My phone started blowing up around 5:36 a.m. All these text messages are coming through, and essentially what we were alerted to, that there was some very suspicious activity happening. Email was down. That was the first indication. And we invoked a code gray, which essentially a code gray is going to, it's alerting that there's something happening with the organization. And we go to these procedures that allow us to do things in a much safer manner. So we're not relying on technology. By the time the morning passed us, we realized from messaging that we were getting from partners that something had happened with our IT systems. And and if I'm stating the obvious, just bear with me. In the province of Ontario, a number of years ago, shared service organizations were established. And so part of our shared service organization is an organization called Transform, which I'm sure you have now heard about quite a bit. Transform is owned by the hospitals. The hospitals that own Transform in this part of the region include Blue Water Health from Sarnia, Chatham-Kent Health Alliance from Chatham, of course, ourselves, Hotel Dieu Grace Healthcare on Prince Road, Windsor Regional Hospital, and Erie Shores Healthcare in Leamington. We are the owners, and we are board members, in addition to community board members. So that's how it's established. And what Transform does is all of our IT, all of our procurement, material management, some very important work. And they were established years ago as a way of centralizing, creating efficiencies, and supporting the healthcare system. Now, we're not the only partners they support, but we are the big partners. It was determined very quickly by Wednesday morning, and between Monday and Wednesday, there was a flurry of activities. We had established Gmail accounts, we were using personal devices, and we're finding backdoor and offline ways of trying to connect. And by that, I mean the 5 CEOs of the hospital and the CEO of Transform as well. We very quickly lawyered up, and by that I mean we were able to bring in legal team from BLG who, believe it or not, and for me this is all new to me, so this may not be new to you. Lawyers who do this for a living, this is all they do, is provide support to organizations that have been attacked through a cyber attack and are subjected to ransomware. Outstanding individuals, incredibly intelligent, and the team that we're working with in Ontario from Toronto, they're renowned as some of the best in the country, so we're quite fortunate in that respect. I will tell you that our insurance company called Highrock has been outstandingly supportive. So you're dealing with Highrock, you're dealing with legal counsel, you're dealing with the Privacy Commission, you're dealing with Ontario Health, which of course is the arm of the Ministry of Health, and the government of Ontario in general. We determined within 48 hours that it was a ransomware attack. At that point, we also brought in a cyber IT company that specializes in this as well. And what they specialize in is, firstly, getting a handle on what's going on, and really establishing essentially contact with the threat actor. By Wednesday morning, we knew that we were under some sort of threat or attack. And the way it works, I guess, I say this because this was, again, very much a learning experience for all of us, is that there's a portal that creates the connection, the communication with the threat actor. And by about Wednesday afternoon, it was decided that through our legal counsel and the IT experts that facilitate this, that we would establish the contact with them. So we waited about 48 hours. And because what we learned then, which I didn't know, is that once you establish contact, the clock ticks. And typically what we've learned is that it's about a 4 or 5 day period of time that's established. So literally it's like watching a Jason Bourne movie. You click on the portal, you start talking to the bad guys, and the clock ticks. And by that, we mean by Saturday night at midnight, we had to respond as to whether or not we would pay the ransom. And so we needed to ensure that what we were doing was communicating in a way that the threat actor felt that we're being serious, very authentic, and very genuine about the negotiations. And I can tell you, I'm in my 36th year of work, my career. 36 years I've been a public servant. And I worked in some very fascinating roles in my career, and some really daunting experiences and decisions. This was one of the most stressful, demanding, and frightening experiences of my career. The part where we had to go back and forth, and I'll speak for myself, not for my colleagues, the other CEOs. We didn't know what to do. I'd be misleading you to suggest otherwise, that we were confident in our decision from moment one. We weren't. If this was just about us, the decision would have been automatic. We're not paying the ransom. We had to think about 15,000 or so employees in the system. We had to think of the, not tens of thousands, but hundreds of thousands of patients and families that likely would be affected. We had to think about what would happen going forward. We talked about, what's this going to look like when we have microphones stuck in front of us in a month or 2 months? We were asked, did you think about paying the ransom? Did you think about the fallout? Did you think about the consequences? So we were torn. We were meeting 2 or 3 times a day. We were talking to anyone who could give us advice on prior experience. I will state that the province of Ontario, Ontario Health in particular, made it very clear that their position from a government perspective was, don't pay the ransom. It was multiple 7-figure amount that was being requested. So it wasn't chump change. I can tell you that from an insurance perspective, we have outstanding coverage as it relates to restoration and bringing in legal experts and IT experts. There is rarely any good coverage for a ransom. And I can tell you that the ransom coverage was $75,000 per organization. And that's quite purposeful, as I've learned. They don't want to advertise that they have this type of coverage available to organizations, because it would incentivize threat actors to come after you. That makes sense.
Mhm.
So as we were contemplating this difficult decision going into Saturday night, the clock was ticking. Our lawyers were able to successfully negotiate an extension. And I can tell you that that was one of the first watershed moments. That Saturday was so important. I'll share with you why in a moment. Because we were still contemplating paying ransom. We didn't know what the right thing to do was, morally, ethically, and otherwise. Even though our funders are saying don't pay it, but do what you have to do, and we're getting advice to not do it. At that point, the OPP were involved from a law enforcement perspective. That was their investigation. And the investigation, the physical location for it was in Sarnia, Lambton County area. By that Saturday, and by virtue of that extension, we had a little bit more time. We learned who the threat actor was. They were able to identify the threat actor, a very sophisticated criminal organization from the other side of the world. They actually had a profile on it. It triggered both the FBI and Interpol to become involved. The FBI had some experience with this threat actor, so they know who they are. They just, as you can imagine, can't find them. And the Interpol became involved because of who they were, the profile of who they were. We actually learned of their name, Diaxin. We learned of who they had victimized before. There were some private sector companies that went after, such as a couple of airlines from the Pacific Rim. But they had this propensity to go after healthcare organizations, children's hospitals. They had this track record. And our legal counsel said something to us that Saturday that was, it was surreal, and I couldn't get my head around it. They said, they're a reputable threat actor. You can trust them. And by that he meant they had a track record of saying to organizations, we will release the information to you if you pay the ransom. And they had a reputation for doing that, which apparently is important to know. And their reputation is important because they would otherwise fail as it related to going out and victimizing other organizations. We had a promise from them that they would provide us a decryptor and not transfer any data that they had. What we didn't know is how much they had copied. And I don't have an IT background, so I'm regurgitating to you what I learned in the last 178 days or so. We had a promise from them that they hadn't copied anything or shared it with anyone. And so I can tell you that into that Saturday evening, we believed them. We were relieved we had a deadline extended. It just gave us a bit of a comfort level. So we were meeting into Saturday, but through our IT company, a company called iSecurity that was working with us. And I don't know how, so just bear with me. I'll just state the fact. They were able to determine that some material had already been copied, and it had already been transferred to what they described as the dark web, something to that effect. So Sunday morning, about 6:30 in the morning, we hopped on a Zoom. Again, we're using personal devices and everything, just to make that very clear. And our legal counsel came on, Eric came on and said, this is what we learned. Our decision was easy after that. Said, we're not paying ransom. They're lying to us. We can't risk that. And we were prepared to accept the consequences of not paying ransom and what that would look like. Clearly, that ended up being the right decision. What we tried to do for about 3 days is constructively foot drag that threat actor. We needed time to get ready for what was about to hit us. We knew that the impact of this would be tremendously catastrophic and challenging. So they're trying to negotiate. And I saw some of the messaging, and again, very surreal to see the messaging between our negotiator and this threat actor. Would you consider reducing the amount? No. Do you realize that one of our hospitals has not been able to continue with providing cancer treatment to patients? We have pediatric services. We have mental health programs. Our services have been impeded. And one of their messages was, that is on you. Clearly, you're no different than us. I'm paraphrasing. They said, clearly, you're no different than us because money is more important to you than your patients. And so the negotiations fell flat. If you remember the timelines, it was about Wednesday, about 10 days later, that they started sharing our data in tranches. There was 3 tranches of data. In the meanwhile, we had to prepare our people for this. So from October 22nd, 23rd, when this happened, to as recently as last week when we had our press conference. We had issued approximately 8 media releases. We've had dozens of town hall meetings. We've issued correspondence to our people. We've had 2 major press conferences. And we've been trying to share as much as we can. And I know that Transform has been characterized as not being very transparent. Not to defend Transform or their staff. But, and I know, again, I'm stating the obvious. You've got 3 law enforcement agencies still conducting an investigation. You're victimized by a criminal entity. We have a class action lawsuit hanging over our heads that was issued to us some time ago. You can't go out and talk about these things. You simply can't disclose. We likely will never be able to talk about some of the restoration strategies, because that would then fly in the face of protecting the organizations that you're trying to protect. But by Wednesday, they knew that we weren't going to pay. We told them essentially it's not going to happen. And they followed through on their threats. And so in the first instance, we learned that they gained access a few days from what we know today and what's been shared publicly. They gained access before the weekend that we knew about it. So it took a few days for us to find out. They gained access through one specific area. The reason why Blue Water Health, if you follow the story, Blue Water Health has been hit significantly. In fact, if you remember the media reports, you might recall that they had something in the range of 250,000 individuals that were likely affected in the first reporting. That's because that's essentially where the point of entry was for these folks. And I guess what happens is they laterally start moving across the system. And within about 90 minutes, they were able to impact the 5 hospitals, Transform Shared Services, and to a lesser extent, Hospice of Windsor and Essex County. And I think it was the Tilbury Health Unit, if I remember correctly as well, to a far lesser extent. Before we started, they got into a number of our drives and they compromised files. And in the first reporting at our hospital, we knew that they had access to all the personal information of about 1,400 of our employees, dating back a specific period of time. It was over a period of 13 months. And so we issued notice to our employees. We had town halls. And I shared this story with many of them at town halls, and I'll share this with you. Banking information was not stolen or compromised. SIN numbers were not, but dates of birth and some other information of that nature was. And in my case, I was hired in this role about 2 years ago. When I got hired in the role, they needed some updated information. So I had to provide a copy of my passport, driver's license, SIN number, all kinds of information, because the banking information had to change, right? Well, I provided pictures of that, and someone left that on one of our drives. So all of my personal information had been compromised. And I can tell you that, in a way, I'm glad it happened, because I was able to stand in front of everyone and say, my information was the most compromised. They have everything of mine. And I am scared, and I do feel vulnerable, and I worry for my family. But I'm going to do what you do. And that's what I said to our team. I'm going to sign up for TransUnion, have them monitor my stuff. I connected with CRA. There's a monitoring opportunity through CRA as well. I'm not changing my credit cards, not changing my banking information. I'm not going to rip up any credit cards at all. I'm just going to watch and monitor, because the banking system in Canada is one of the best banking systems in the world. As heavily regulated as we are, as frustrated as it may be from time to time, it's effective. And so it was really important that I could walk the talk. What I was advising our people to do, I was doing. And I wanted to share how vulnerable we felt as leaders, because it needed to be something that we needed to reassure our folks with. And we needed to let them know that we had it. We were in control. We're doing our best. What followed was much of what you've seen in the public domain. Information that's been shared. There were 3 tranches. There was some pretty unsettling information shared on the dark web. There was concern around identity theft, concern about medical records. The Privacy Commission of Ontario has been watching us very carefully, because the size and scope of this breach is massive compared to what they've seen before. What I've learned is I had no idea at the frequency of these breaches and cyber attacks and ransomware attacks that happen in industry and in the public sector, because most times you don't hear about it, especially private sector. I can tell you that I have met with, through normal course of business, 3 local private sector companies who very openly and unsolicited shared with me, Bill, we went through it. The most recent was someone that we likely all know, runs a very successful business, second generation. And he said, yeah, we got crushed. They accessed our financial records. They were down for a complete month. And I asked the question, did you pay? He said, yes, we paid. My own uncle, who's a GTA business person, who owns a real estate brokerage, never said anything to us. Well, 2 years ago it happened. And he's given me permission to share this. He, when he found out what happened to us, he said, Billy, we went through it. I said, Uncle Mary, you went through it. He goes, I go, what did you do? He goes, we paid. What choice did we have? And they paid, and they've since gone on to improve their systems. But those are 2 very anecdotal stories. I've heard many of them. And as you probably know, around the time we were issuing notices, so was Caesars. And so were a number of other companies locally. So there were people in our community that were getting multiple letters from organizations because of cyber attacks. And I think the lesson here is this is our reality. I have 3 kids in their 20s. This is going to be their world. So where are we at today? Today is Thursday. On Monday of this week, of the April 8th, we started issuing letters to people who we feel should be notified based on the breach. So even if the way it's worked through the Privacy Commission, even if Ed Links appeared in what they call the e-discovery, even if it's just his name, Ed's going to get a letter. We're going to give him a phone number to call. And when Ed calls us, we're going to say, Ed, it was the fact that you were on a wait list for our cardiac rehab program, or Panos, you were on a wait list because your name appeared there because you were escorting a family member for an appointment. So it could be something that simple, or it could be far more detailed. Diagnoses, prognoses, many of our mental health files were compromised. So we're issuing about 46,000 letters. And if you followed the media event last week, we're well over 330 or 340,000 letters that have gone out this week from the 5 hospitals. And so we've established hotlines, if you will, dedicated phone numbers, 1-800 numbers, and local numbers for people to call. We will share everything that we have available to us. Full medical records were not compromised, but medical information, wait lists, referrals, some diagnosis information has been disclosed. Very few SIN numbers, because we typically don't ask for that information in hospitals, but if there were patients that were there on work-related injuries that were on worker safety, were involved with the Worker Safety Insurance Board or other insurance companies, then that information would be there. The heavy lifting of restoration is going to be with us for at least another 12 months. By and large, we're fairly well operational. We lifted our code gray about 2 weeks ago at Hotel de Grace Healthcare, and it's very arbitrary and it's subjective as far as when you lift it. And I felt very strongly that we not rescind our code gray until such time that we could safely say that all of our systems were reasonably operational and we had mitigated risks. And for us on Prince Road, it was our financial systems, our accounts payable essentially, and our security that still had not been fully restored. And for us, security is important. We have personal alarms that are GPS. It's on a GPS platform that people can press when they're in a dire situation. Swipe access. We couldn't give swipe access to a number of new employees for the first 3 months. So those platforms, I thought about it and I thought, until I can confidently look at people in the face and say, we're safe from a security lens, from a financial lens, from a risk mitigation perspective, that's when we decided to rescind. And that was about 2 weeks ago. We have a lot of work ahead of us from a restoration perspective. And we just met last night. We met as a board at Transform, and we got an update on restoration. Restoration is working hand in glove with modifications and enhancements. But the real challenge, as I understand it, is going to be, how do we stay one step ahead of these IT geniuses and experts that have chosen this lifestyle, that have chosen to be criminals and victimized, because ultimately that's what happened. We were victimized by a sophisticated criminal syndicate. And that's gonna be the ever challenging question, no matter what we are doing. We have to continue to proactively find ways to stay ahead of any cybersecurity risks. Especially in the province of Ontario, where the direction has been to continually centralize these back office systems. With it comes the business efficiencies, I get it, financial savings, but the risk is greater. Imagine for a moment if our healthcare systems were centralized across the entire province of Ontario. We've been going through hell the last 180 days or so. That would have shut down the province on many fronts. We've had vendors that have chosen to do business with us differently. There were vendors that wouldn't even talk to us for the longest time, but yet expecting payment, by the way, and we get it. Because they were afraid to connect to our systems. We've had to prove, and we're still doing that. We're still going through authentication processes and proving to them that doing business with Hotel de Grace or Windsor Region or Transform or anyone else is safe. And so it's changed us from a business perspective. It's changed us from a psychological and mental health perspective. I was sharing with panelists, there's this hypersensitivity to everything that happens. I can't tell you how many of my colleagues will say to me, if I don't recognize the number, I don't respond. We're not getting emails anymore like we used to because of these firewalls that have been established and a lot of protection there. And I get it, that's important. I was sharing this with panelists as well. I have a very senior colleague, a very intelligent and important person in our organization who's so concerned about it that when this person sees an email come in, this person will double back and call, let's say it's an email that I'm getting from Bill Marra. I will call Bill Marra's office and confirm, Bill, did you just send an email? And until my colleague establishes that report and knows for sure that it's it, that that's legitimate, she won't do business with that person. In other words, she won't respond to emails or phone calls. It's that vulnerability is likely not going to go away for a long, long time. And when we compare it to what we went through in the pandemic, we kind of had an understanding. It's a virus. We knew what to do to mitigate risk within our four walls. The vaccines happen, whether you're pro-vaccine or not, vaccines happen. We knew that was a tool. And we've come to terms with it. COVID is what it is. It's a virus, we can go with it. This is different. This has created a seismic shift in how people approach technology in our organizations. It scared the heck out of a lot of people. It exposed us to a vulnerability that's, even talking about it creates anxiety. And so part of our challenge internally, and I know that all four of my other colleagues are going through this as well, is trying to reassure our people that we're doing everything we can to protect them and mitigate risk and mitigate vulnerability. I know that time is limited, so I'm gonna stop there. I'm happy to answer questions. And I'm sorry for stopping mid-flight, but I'm also cognizant of time, and I have an 8:30 meeting that I will definitely be late for. So why don't we go around the room?
Bill, is this the same organization that attacked sick kids, or are you allowed to tell us that?
I can tell you that it's not. I can say that. Yeah.
Okay, quick follow-up. Did you reach out, or did Transform reach out to sick kids was prior to learn from their experience, and have other institutions, hospitals in Ontario reached out to say, how can you help us? So we're not in the same.
Yeah, there have been some discussions, but even with local folks, for example, with Rob Gordon and his team at the University of Windsor, not myself, but we reached out to the University of Windsor because of their recent event as well. So there have been some learnings. That's a good question, because Ontario Health wants us also to provide a report that they can share with other institutions. They feel very good about a number of things we did, Bob. They felt we did some things really well. Some things we did very poorly. We didn't take a perfect approach to this, and there were some things that could have been and should have been done in advance that may have mitigated the risk. But it's not about aligning or assigning blame, rather, it's about learning, because ultimately we were victimized by a criminal syndicate. We're victims of a crime. So you don't re-victimize victims of a crime. But Ontario Health is expecting a report from us, as is the Privacy Commission, as you can imagine. That will be shared as well. But there were informal connections, to answer your question. Yes, we also learned quite a bit from legal counsel, because Eric, our lead legal counsel, Eric Charleston, is involved right now with about a half a dozen breaches across the country. So we were also learning from their experience as well as from the iSecurity company, and there was another company called Pro that we deal with. They brought a lot of experience to the table. But yeah, we're trying to learn from each other.
Thank you.
Yeah, it's good questions.
Perhaps we can hold the questions for a second, because we do have a little presentation that this can come up.
Bill, it's my pleasure. This is sometime in the making, I understand, because we had this already, which we have an opportunity to get together with you and present this to you. So we have, as a club, recognized you through what's known as the Paul Harris for Rotary. So we made a contribution in your name some time ago for your support of our club over the years. And we had a certificate for you, which we are now presenting. So this is your Paul Harris Fellow Certificate, which indicates you are a Paul Harris Fellow. We made a contribution in your name to Rotary International Foundation in support of the foundation. So there's a certificate for you.
Wow.
No, you have to rush out to it, that we get there.
I'm blown away by this. Thank you so very much. This is very,
Earliest picture.
thank you.
I got a close up.
Sure.
By this.
Thank you to all of you.
Or more by the end.
We either gotta get in or get out.
Get in, Bill.
Get in, Bill. Get in, Bill.
Great, thanks.
Thank you so much.
You are.
Very humbled by this. Thank you.
But I don't,
I promise you I will.
you can do your thing.